Stephen, our son, was born with an isolated unilateral cleft lip and palate.
He was diagnosed at our 20-week ultrasound. It was heartbreaking, to say the least.
Absolutely. The high-risk doctor that diagnosed Stephen instructed us to go to CHOP, and he had already sent our information along. That's how much conviction he had in Children's Hospital Philadelphia. Not knowing anything about cleft lip and palate, not knowing what his future would look like, not knowing what the treatments were.
All we knew was this was the place to come if you had a child that needed the care. We were welcomed with open arms from the minute we walked in the door.
They introduced themselves on a first-name basis. They sat with us. We felt as if we were the only people in that hospital having anything done that day.
Our plan of care for him was to proceed with nasoalveolar molding so that we could get him ready for surgery and optimize his lip and palate care. And then when he was ready, we repaired his cleft lip.
Stephen has been through a lot. His first surgery was at 4 months old. That was to fix his lip and his nose. Then at 10 months old, he has his palate corrected.
Primarily coronal.
This team they're just amazing people. They're passionate about what they do. They care about you on such a personal level.
And every time we have an issue, whether it's hearing, feeding, speech, whatever it may be, there's somebody waiting right there to answer that question and assist us with that.
When I first met them, they were terrified. They were terrified about going through surgery. And as we went through this process, they became more comfortable and more confident. And Stephen's done really well.
Dr. Jackson is awesome. She's a wonderful person, and it just was very comforting knowing that your tiny, tiny little baby is going to be placed in her arms.
The first year is scary. Coming up on Stephen's second birthday, and it's a very different story. It certainly gets easier, especially as your child progresses through the surgeries. You get less people looking at him when you're at the grocery store, and more people just recognizing that you have an adorable 18-month-old child.